Hello and welcome everyone. This is welcome to the virtual series of PLAB and other pathways to enter UK healthcare system as an international medical graduate. I welcome Dr. Nikhil, who is an internal medicine trainee at Southend University Hospital NHS Trust. So yeah, let's get started.
Hello, Dr. Nikhil. The first question which we would like want you to answer is, can you give us an overview about the PLAB exam?
Right. So to give the PLAB exam, you need to have completed your MBBS. But although people do tend to sit for the exams in the internship itself, one of the prerequisites to do PLAB exam is to clear your IELTS exam with the required score, if you're aware of it. And once you're done with that, you sit for PLAB 1, which is the MCQ exam, and you sit for the PLAB 2 exam, which is a little more OSCE based, for which you have to come to the UK to sit for it. And after you're done clearing both the exams, you get the GMC registration, after which you're free to come and practice medicine here. So it's a 3-step exam, I would say, including IELTS. People seem to overlook that. And yeah, that should be fine, I guess. Yeah.
Thank you.
Dr. Nikhil. Next question is very common. People often ask this: how to prepare for IELTS and PLAB 1 and PLAB 2? Like, do you do anything specific for these exams?
What I did for PLAB, let's start with IELTS. It's people think because they can speak English and understand English, it's an easy exam. Trust me, it is not. Because I mean, I'm not really questioning your English here, but the thing is, the exam really demands certain things from you. The listening, writing part, there's reading part, and then there's the speaking part. There's 4 different areas which you have to cover, of which the writing part is the most difficult one, because there's a pattern in which you have to write your essays. And once you are aware and once you know how these patterns are expected from you, then it should be okay. I took about a month to prepare, because it's very important to know the way in which they would expect things from you. There's a certain way in which you have to write your essay. Once you're done with that, I use the Cambridge modules. They come up with their, the Cambridge has their own textbook that you can use to practice these exams. I used from the version 8. I think 8 was a good one, beyond which every other issue was quite good to use. Before 8, I think the versions before 8 are a bit obsolete at this point. So if you want to prepare for IELTS, I would suggest start preparing from the 8th module. And there's a very nice channel on YouTube called Liz IELTS. It's run by a lady in the UK called Elizabeth, and she has a channel called as Liz IELTS. If you go through her video series, you know what this exam wants from you. And once you are done practicing those, I think you should be fine and you should be ready. And work on your handwriting, work on your grammar. I think it should be fine after that.
People often ask this question, like IELTS or OET, like which one is better? Like people are giving OET, a lot of people are giving OET now. So like which exam is better to give?
Right. So so when I gave my exam, there was just the IELTS which was accepted. And I think about a year or 2 ago, they started accepting the OET exams as well. I would say both are equally difficult and easy. If you sit for the IELTS exams, there's a very specific one you have to give. There's many different types of IELTS exams. The one that you have to sit for is the UKVI academic version of the IELTS. Once you have passed that exam, then it opens up many different avenues. Some people are interested in getting in doing masters for a while and then coming to practice medicine here in the UK. OET, I think it just restricts you to just the GMC exam. and there's many. And the thing is, OET is a fairly new exam as compared to IELTS. There's not a lot of, I would say, study material. There's not a lot of experience out there. IELTS, people know about it. There's many people who've sat for the exams, who will be willing to help you. OET, not so much. I'm not saying it's a bad exam, but it's just there's not a lot of help available out there, I would say. So if you ask me, I would suggest sitting for the IELTS exams. And IELTS exams is a very general exam where they can ask you things ranging from anything to anything. OET would be a little more specific to medicine. So if you mess up your medical terms in OET, that loses points. I would rather go for an exam where they ask me general stuff about the news than have to answer medical things. So yeah, I mean, both the exams are open for you actually.
All right, thank you so much. Now I would want to ask you a little bit about the application process and the exam centers for PLAB 1 and PLAB 2.
Right. PLAB 1 happens about 4 times a year. There's one in, I would say, so the one that happens in June and September happens only in the UK, and the one that happens in the first part of the year, and the one that happens in December or the late November happens all across the world. After I was done with my internship by around mid-January, the nearest exam that was possible for me to sit was the March exam, which I did not have enough time to prepare for. The only exam available was the June. So to summarize it, there's exam in March, June, September, and end of November, I would say. June and September happen only in the UK. March and November happen all across the world. Now, depending on what your timeline is, how fast you want to get it done with, or how much time you need for preparation, you can choose the exam center you want to go to. Mumbai is definitely one of the centers. There's Delhi, there's Chennai, and there's Kolkata as well, if I'm not wrong, to sit for your PLAB exams. But then again, you get restricted to just the March and the November exam. So if you want to do it fast, just go to the UK in the month of June after you're done with your internship and sit for the exam, and you can be done with it. Contrary to that, PLAB 2 exams happen only and only exclusively in the UK because it's an OSCE exam. I don't know if you guys are aware how OSCE exams really run, but I'm happy to explain that in a while. I think back in 2018 they had centers running only in Manchester, but after a while they started opening up centers because there's a lot of demand all across the world to sit for the PLAB exams. Manchester wasn't enough, but they've started opening up more centers in London and in Cambridge now. So they have a lot of the exam centers, but only in the UK. But again, because of COVID, these exams are again quite limited. So it's just we have to look at it day to day by now.
How do you prepare for PLAB 1 and PLAB 2? People often go for courses to UK. They take courses, different courses. There are a lot of courses available in UK. They take those courses and then they get. Is it necessary to take these courses?
I don't really think it's necessary. There's for every exam, there's a study prep manual you can use to study and prepare for these exams. Like NEET has their own set of questions, USMLE have their own set of questions, AMC, NZREX, and MCCCQ have their own set of questions. Just like that, PLAB have their own set of questions, which can be studied, can be solved online as well. There's many different websites you can look for. I think there's Past Medicine, there's QBank, there's Past Test.
PLABable.
Sorry?
There's something called as PLABable.
There's PLABable as well. Of course, you're right. You can use these to practice for these MCQs specifically. But again, these questions won't really be repeated again in the exams. It's just for you to understand the basics of medicine, I would say. Pattern of it, of course. So yeah, I would suggest, if you have the financial base to support you through it, go for the academies. There's literally no harm in it. But practicing these MCQs over and over again is a little more important, and I know people who've done it just doing the MCQs.
All right. Thank you. So now I want to ask you a little bit about the electives and your CV.
Yeah. Electives. Now, electives is a little more USMLA specific. What people who want to get into the UK or work in the NHS have to do something called as an observership. It's just the same as electives, to be honest. But it's so there's many different reasons why people would do the observerships, because they want to get to know the NHS a little more before making the decision. People go for these electives, like I'm sure students with you who've gone for electives in the US in the second year or in the third year. But the reason they go is just to get a little more idea how the US system works or the UK system works. Not something that is mandatory, but for your own self, I would suggest you could go for it. I didn't really go for it, to be honest, because for me, I wanted to clear my exams first and then start working in the NHS directly. It does add to your CV a little, but that's just for your first job, I would say, not for the jobs after that. So yeah, I think observerships could be a good addition to yourself more than your CV, for you to know if you made the right decision or not, if that makes sense to you.
So, like, we are working for like council and all this year in the college. So, does it help to like for our CV? Does it like is it really count for our CV? These things?
Like working in the student council.
Yeah, like working for any committee or any type of NGO or any such things in the college years.
Like, we
Right.
have co-curricular, extracurricular activities which we organize.
Yeah.
So
Yeah.
do those certificates of organizing, do they like help add on to our CV for UK?
Right. Right. Okay. I think they do. I'm inclined on believing that they do. Where these things matter in the UK and where these things are really counted is when you apply for a specialty, like to get into a training program, where there's a scoring system and they see if you've done anything extracurricular, if you have any achievements outside medicine, if you have arranged for any teaching session, if you have been in a leadership role. Like for example, you both are in the student council. That I would say, in my belief, I would say it counts as a leadership role. That I feel would definitely count in the UK, and that would help and enhance your CV. So I I think it's a good idea to go ahead with it and to count it in your CV. Yes, definitely.
Okay, so next question is people often ask this after passing PLAB 2, how difficult or how easy is it to get the jobs in UK and training versus
uh,
not jobs again?
right. This is a very seasonal thing, to be honest. When I started with my PLAB 1 exam and I was starting to get into the UK scene, jobs were a little more difficult. Uh, I wouldn't say there were no jobs, but it was a little more difficult for a person from outside the UK and even EU to get in, right? But then the government changed and Brexit happened.
Hmm.
And UK government became a little, contrary to the popular belief, UK government got a little more lenient, actually, with respect to IMGs getting jobs. Um, then it became a little easy to get jobs. And again, there was a small time period when Home Ministry changed a few regulations here and there. Again, it became a little difficult. So what I'm trying to say here, what I'm trying to emphasize is it's a cyclical manner in which these things run. Now, I would say in the year of 1999 to 2005, it was near impossible to get into the UK. After that, again, for a few years, it became easy. And then up until 2015 or so, 15, 16, again, very difficult. I would say now is a very good time to get into the UK because of what's happened. What I have noticed so far is because of Brexit, a lot of my European colleagues have left their jobs and gone back home. So it's made a little more favorable, I would say, for people to get jobs. Again, NHS is very deficient in doctors, I would say. So a little difficult for someone who's an IMG because they don't know how things run here. But once you're in the system, I don't think it's very difficult.
All right. So now I want to ask you about the GP training and residency, which happens after the IELTS PLAB 1 and PLAB 2. If you could tell us a little bit about that.
Okay, sorry. So do you mean the whole GP journey or getting into GP's training? What is
getting into GP training?
Right.
Other like getting into GP and any other specialty for that matter, like into a training specialty, like how difficult is it to get GP and other training like cardiology for say or radiology for say?
Right. Once you're done with your PLAB 2 exam and you've got your GMC registration, I would say I would personally suggest you work for a year in a non-training capacity, because it's very difficult to understand the NHS system. There's many different pathways. There's not just in your training curriculum, but also in the day-to-day working of the hospital. So getting to know these would take around a year. So I was in a training program for a year, just at a I was in a training program which was a pre-training program kind of period, where as a person who's done internship and not worked after that, I did a year of working in a hospital just to get to know the system. And trust me, it takes a bit of time, because there's a lot more responsibility on you than you would imagine than you had in your internship. So doing that 1 year is very important. And after that, I think you should apply for the training program. Now, there's many different training programs you could get into. If we see GP first, GP is run over a period of 3 years. Although there's talks right now of making GP training into 5 years actually. GP training. So what happens is, to get into GP training program, you have to give a small exam again. It's called as the MSRA exam. It's an exam where they again test you on many different specialties, because as a GP you'll be expected to see all the patients of all specialties, isn't it? That will be from medicine, surgery, obs and gynae, pediatrics, dermatology, everyone. So you have to pass this exam, go for interviews, and then get in. Although if you do GP training, you'll be very the training that you get in GP training is a little more specific to the UK. You can, after you're done with your training, you can work in Northern Ireland, Scotland, or in England and Wales, of course. There's other training programs as well. There's medicine, there's surgery, and like radiology, like Agam mentioned. These are very, very competitive specialties to get into, because as IMGs, I feel we lack in the portfolio, not in knowledge base, because knowledge, I feel it's same everywhere, but portfolio is something that IMGs really lack at. If you have that, and if your interview went well, I don't think it's very difficult. But again, there's competition ratios. I think there's a website by Omar and by Nasir that you can have a look at, where he has mentioned all the competition ratios, so that you can have a look what you're interested in and what the competition ratios are. So after my 1 year of working in the UK, I applied for internal medicine training. It was a bit difficult to get in, but for that 1 year where I was working here, I was just building my CV. It took me some time to build my CV, and then I could get into. You can get into the training programs directly, but I wouldn't really suggest this because uh, what happens is if you get into the training program directly, they expect certain things from you. They expect you to know things. They expect you to know how NHS works. They expect you to know how to talk to patients, which none of us do actually, to be honest, because we don't know what their culture is. We don't know what their pathways are or how their departments run. So if you're in the training program and you don't know, that reflects bad on you. So work for a year or two, then get into training, I would suggest.
Okay. So there's one more question, like how did you manage your finances? Like what exact from starting from IELTS to PLAB to what are the finances and expenditure? Like how much money do you need to have to like
To support the way, support your way through
yeah,
the
yeah,
preparation. Right,
yeah.
right, right. What I last heard is IELTS. When I sat for my IELTS exam, it was the fees were about 18.5 thousand rupees. But I think they've reduced it now to 16.5. That's what someone was telling me the other day. Doesn't matter. It's somewhere under 20,000 rupees. After which you can sit for your PLAB 1 exams and PLAB 2 exams. Now, if you plan to sit for your PLAB 1 exams in India, I think they cost about 20. It's 230 pounds. That must be around 21,500 rupees, something around that.
Mm.
And PLAB 2 exams were 840 pounds. That is 79,000 rupees. So in total, for all these three exams, in rupees, I would say would go about um, let's say 1.1 or 1.2 lakhs to
And if you
complete
do
the exam.
like airfare and all, when we have to give the PLAB too, so it can go up to like 2 to 3 lakhs. That's the max.
Something like that. Yeah, yeah. And then if you plan to go for the academies, if you plan to stay there for a while, your food, your travel here and there, if you plan to buy something, two, three, yeah, sure, it's something. I think that's
Something around.
feasible. Yeah.
All right, thanks. So now I want to ask you about the PLAB versus MRCP between both these.
People are now going towards MRCP these days because they are like give MRCP from India and then they go to the UK. So, what do you suggest to our viewers for this?
Right. Sorry, if I can ask you, who have you talked to about this, about preferring MRCP over PLAB? Are these residents or are these medical students?
So these people are residents basically. So I've been going through a lot of vlogs and Nasi's vlogs and all. So over there, a lot of people were telling about these things, MRCP and lab and all. So people are shifting towards MRCP. That's what I've heard. Like, what do you suggest for this?
Right. So there's there's a reason why I asked you, is it the residents or the medical students talking about this? Because as a resident in internal medicine, it's quite natural for them to gravitate towards MRCP. I don't know if you're aware what MRCP is exactly. Just to break it down in very simple words, MRCP is an exam that you give, after which you can be kind of called as the in Indian terms, I would say like a MD pass out.
Okay.
Okay, like at the end of MD, at the end of the 3 years of MD, you sit for the final exam, and then you are the MD person, right? MRCP is something similar to that. MRCP, I would say, to put it in very simple words, it would be like an exam that you sit at the end of the residency, and then once you pass there, and then you are qualified as an MD person.
So it's basically
So if yeah, sorry, go on.
it's basically a step ahead, more like one step ahead of lab. MRCP is one
Yeah,
step of lab, I guess.
yes, exactly. So MRCP is something that is more preferred by residents because they don't want to sit for PLAB again, because PLAB will test them on obs and gynae surgery, which they have not had a touch with for some time now, and something probably they don't like it themselves. So MRCP, they've been practicing medicine for 3 years now, and they know medicine a little more than what a medical student would know. So obviously they will they would prefer MRCP over PLAB. But as a medical student who's just been studying all these different specialties like surgery, pediatrics, orthopedics, dermatology, obs and gynae, would prefer to go for PLAB. I don't really believe that uh, MRCP is a little more preferred today than PLAB. I think both are the same, I would say, because if you look at the mean age at which people are coming to the UK, most people are coming after they've done their MD. A very short, small percentage of people are small percentage of doctors who've just done their MBBS and are coming to the UK. Most of them are way in their 30s, 35s, and then they're coming. That's why on online vlogs or blogs that you come across, it will be a little more biased than you would think, because most of these blogs are written by doctors who have done their masters or they've done their post graduation. So you'll come across a lot of comments who would say, "Oh no, MRCP is better than PLAB." But again, you have to make a decision what you want to do.
Okay. So we have often heard that like UK living cost in UK is a bit like UK is a bit more expensive than India is obviously. So like the salary you get, does that support the proper like lifestyle over there when you live?
Right. There's many blogs that I came across when I was just starting out on my PLAB journey, where they mentioned that as a, like, for example, if you're just new into the UK and this is literally your first job, you wouldn't really get a job of more than £45,000 a year. Nothing more than that. If you break that down into a monthly salary after tax, that would mean you're earning somewhere around 2,400 to 2,500 £100 a month, and that's including the on calls and the night shift that you'll have to do. I think that amount of money, that is 24 to 2,500 pounds a month, I think that's enough to support one person, not a family. Again, like I said, most of the people who are coming to the UK are the people who are in their 30s, in their 35s. They already have a family, they have a kid. So if they come over to the UK, supporting a family of 3 would be a little more difficult on that salary. But if you're just a single person who has no dependents, no one you have to send money to back home, then I think 2,500 as the first salary would be fine. If that makes sense to you. Yeah.
Okay, so now we will be moving on to the questions which we had received from our students from our college, those who have reacted to our stories. So the first question will be from Shruti of 3rd year. She wanted to know how hard was PLAB 2?
Right. PLAB 2 is a OSCE exam. I'm not really sure if you guys are aware how OSCE exams run. Do you want me to tell you in short, or is it something that people know about already?
Like our viewers can watch that. Like,
sorry, say that again.
You can tell like basics about PLAB 2. Basics.
Basically, it's an 18 station exam. What a station would mean is every station, there's a question paper outside which gives you a scenario. It tells you there's a 54-year-old patient who's come in with some so and so symptoms, and this is his past medical history. This is what he has been. These are the medicines he's been taking so far, and now he's come with a new set of problems. How would you deal with that? Now, once you go inside, you have only 8 minutes. 8 minutes is where you have to take the history of the patient from start to the end. Like the ones that you're aware of in your medical school. You start with the name, age, the gender, and then the complaints, the current complaints. Go into the whole details, and then dig your way through into what the possible diagnoses would be. Now, this is just 8 minutes. You have to go through 18 stations, and you keep rotating. Once you're done with this one single room, you come out, go to the next room, you read the question outside, and then you go in again. Again, these are 8 minutes. So this keeps happening. It's a bit more difficult than PLAB 1, definitely. I know people who've had to sit that exam more than once because they couldn't clear it in the first try. Because, again, the cases that you come across are a little more UK specific. I mean, I'm sure you wouldn't really get a scenario in the OSCE exam about a patient with tuberculosis, which is a little more prevalent in India. You'd get someone who's coming with Lyme disease. I mean, how often do we come across Lyme disease in India? Very ever.
Yeah.
I've never really seen a patient in my internship, right? So getting to know these conditions and getting to know their little cues, when the patient talks to you, their culture, the way they talk, the words that they use, you have to get used to that, because they would use a word which is very easy for them and something that is day to day for them, but something new for us. So you'll end up not knowing what they're talking about.
Yeah.
So I think you would need about 2-3 months of preparation for PLAB 2, and that too, like where you have to practice a lot with your friends and then go sit for the exam. I wouldn't say it's a very difficult exam, but it's a little more difficult than PLAB 1. And and I know people, I mean, who've cleared it in their first try as well, so it shouldn't be very difficult.
Okay, so Anirudh from interns, he's an intern right now. He's asking, what is the exact GMC registration process after you pass PLAB 2?
Right, so you have a GMC account at that point anyway, because you have sat for your PLAB 1 exam, your PLAB 2 exam, where they can cross verify if you have really cleared your PLAB 2 exam and you've been through that. Then you have to go through a process called as ECFMG, where you have to verify your medical qualification, your medical degree, your MBBS certificate. It's a organization which who get in touch with your college and your hospital to see, have you been a student here? Yeah. And if you have, then they're happy to verify that. So your IELTS, your medical degree, and your PLAB 2 exams. These are very important prerequisites to get the GMC registration. I would say once you're done with your PLAB 2, you can immediately apply for your registration, and shouldn't take more than a month to get the registration, to be honest. It's not a very difficult ordeal. That's like one of the most simplest step in the whole journey.
Shamika from final year would want to know the duration of residency and its advantages.
Okay. Okay. So it's a very valid question, to be honest. I get this a lot, and you'll see a lot of people online talk about this, about the duration and the pros and cons. Do you guys know how long it takes to complete the whole internal medicine training? Just a question for you both.
In the UK or in India?
Both.
In India,
3 years.
3
Yeah.
3 years. In India,
And it takes around 4 to 8 years.
A little, yeah. It takes about 7 to 8 years, depending on what specialty you have chosen. Now, if we talk about internal medicine, it will take you 7 to 8 years, depending on what specialty you have chosen. But again, the first 2 or 3 years will be counted as your just MD, like MD equivalent training period, and beyond which would be a super specialty, right? Now, people, sorry?
It would be like DM, equivalent to India.
Exactly. So people usually get discouraged, thinking, it's a 7-year program. So, I mean, I'm not really going to go for it. It's going to take so much time. But they fail to understand that if you do your MD in India, it's going to take you 3 years. And if you do your DM, it will take you 3 more years. Yeah. And this is, we're thinking that you'll clear your NEET SS and your NEET PG exams in your first try. And only then it'll take you 6 years, right? Usually that doesn't really happen. It takes more than that. So I think the training period in the UK and India is the same. There's uh, just depends on what you really like. Um, if you want to stay in India, I would suggest try for NEET exams. If you want to work in the NHS in the UK, try giving the exams here. I don't really think there's a lot of difference in the time duration as such.
Okay, so Kevin.
Yeah. Shamika wants, she has another question, and she wants to know, in the interview, what all are the things that they ask? What do they look for in a candidate?
Right. Again, it depends on the specialty that you're applying for. Now, I can tell you about internal medicine, where they'll check the very basic ones. If you have the GMC registration, or do you have your medical degree, and then they go on to a little more intricacies. They check if you have done the ALS. The ALS, do you know what ALS is? The Advanced Life Support course.
Yeah,
It's like
Oh, yeah.
it's like a
yeah.
prerequisite again that you need to have as a internal medicine trainee. They do check that, and then they go into checking what qualifications you have other than medicine. Is there anything else you've achieved outside medicine? Is there any masters you've done? Are there any publications, any research you've taken part in, any teaching you have done, any leadership roles that you have played a good part in? I was a part of a Rotary club in my medical school, where I did manage to lead a lot of these medical camps into the rural areas, which helped me show, oh yeah, I've played a role as a leader in one of my previous experiences. So these are some things that they really look at. And again, the interview happens in 3 different stations, so they have their own stations as well. The first station is a clinical station, where again you go inside, they give you a clinical scenario, they see if you're able to know the NHS system, know the different pathways through which the patients can go, and if you're able to deal with that patient right then and there, with the examiners continuously asking you questions what you would do. The second station is a ethical station, where they'll give you a very difficult scenario. Like it's not very common in India when I was there, where about do not resuscitate a patient. That you reach a point in a patient's care where you might have to not resuscitate a patient. So it's an ethical dilemma that you have to take into consideration. Take into consideration the patient's autonomy, justice, malefactions, non-malefactions, and beneficence. As a whole. So you have to wade your way through that ethical dilemma and clear that station again. So these are 2 stations of the interview process. And the third station is the portfolio. Portfolio, I think, would count for about 25 to 33% of your total score. But knowing the clinical part and the ethical part is equally relevant and important to clear the interview process.
Okay, so Rakesh is asking how difficult is it to get into the surgery training for IMEs, basically.
Right. So if you want to get into the surgical training, again, there's a couple of things that they look for. My friend who got into surgery training was asked to make a presentation of about 2 to 3 minutes about qualities that a surgeon really needs to get to become a surgeon, what roles that he needs to play. Now, this is not something that we would write in a 10th standard essay, like you can just write your way through it and expect the teacher would give you marks. But this is a little more specific as to the NHS. If you're aware of the policies here, if you're aware of many different problems that NHS is going through and many different pros and cons, if you're able to wade your way through it, I think it should be fine for that station. Then they also expect you to sit for not really expect you, but they give you a little more points if you have sat for the MRCS exams. Not the whole part, but at least the first step. If you've sat for that, they give you a little more points. If you've went for many different courses, if you've gone for the ATLS course, if you've gone for the ALS course. ATLS is like a trauma course that surgeons have to go through. The competition is steep, I would say, for all the specialties. unless you have an exceptional portfolio and you have good talking skill, if you're able to deal with their clinical station, if you're able to deal with their ethical station, I think it's a doable process, definitely. Yeah. And trust me, there's IMGs who've got into surgery, so I don't think it's very difficult. I think it's just doable, I would say, if you ask me.
So it's not impossible. Like people say that it's very
No,
difficult to get into surgery.
definitely not. No.
Okay.
Isha has a question. She wants to know, now that we have next one dawning on us, like we'll be the first batch to give next one. How would you suggest if we want to go abroad to the UK, preparing for PLAB 1 alongside next one, or once we get done with this, then we start preparing for that? What would you suggest?
Like how much time do you need to prepare for PLAB 1 exactly?
Yeah, with the consideration that we have next also happening.
Right. So I'm sorry, I'm not really aware of what next is coming up with. If you guys could just tell me in short, when are you supposed to give your next exam?
Government
Sorry?
a common final year exam for all the.
Yeah. So when are you supposed to sit for it exactly? At the end of final year or after the internship?
After your final year.
Right. Because they were talking about next exam since when I was in final year, and they've been coming up with many different combinations to give it sit for it after internship or after final exam. But like you're telling me, it has to be done after final exam, right? So I don't think that really affects you a lot if you are planning to go to the UK, because you would really start preparing for PLAB exams when you're in internship. To really prepare for PLAB exams, I would say give it about 5 to 6 months to really get to know the intricacies of the way they would ask you questions. Because even if you prepare for the exams from PLABable or past medicine, they won't really be asking you the same question again. They'll just twist it in such a way where they'll really test if you know what the medicine is and if you can really answer their question. I think 5 to 6 months is something doable. And I know people who've done it in less than that as well.
Okay, Suhani is asking how many times can you give PLAB 1 and PLAB 2?
You can sit for the exam 4 times.
Okay.
But also you can sit for the 5th time, but in very, very exceptional cases. I've not really come across anyone who's had to sit for the 5th exam, 5th try. So I'm not really aware of what those exceptional, like the exceptional circumstances that they're talking about. Most of the people do clear their exam. At least the people I know have cleared their exam within 2 tries. So I don't think you would have to sit for the 5th try as well.
So that was all the questions that we had.
Right. Okay.
So thank you so much for giving us your valuable time and giving us